Good afternoon to all. My name is Godfrey Mashamba. I am from the South African Government Department of Planning, Monitoring and Evaluation. I welcome all of you to this session.
Godfrey, if I can ask you to just check, if you can just check how many tabs you have open and just have a single tab.
I have one tab open. Okay. Good afternoon, all. Let's continue from that. Sorry for the disruption. I was still introducing myself and welcoming you to the session this afternoon on the regional approaches to combating the pandemic. We are going to be looking at the best practices in that area. I'll kick off by making two remarks. Firstly, that as we look at South Africa, we are a country of major contrasts in many ways, be it in terms of locations, the rural-urban divide, population groups, economic status, or otherwise in many ways. And then in periods of crisis, we find that the crisis manifests itself in different ways across the regions. They amplify the differences that exist and therefore require differentiated responses. Even the responses themselves, they work in different ways in various places. So we have seen this recently with the COVID-19 pandemic. And then for that particular reason, we need to understand our analysis of COVID-19 implications, considering those realities. I'm sure the same applies across countries. When you look at across countries, differences, and also in many parts of the world, they do have different sectors. They have different types of strands in society. So in South Africa, the experience that we have learned is that provincial and local government played a crucial role in adapting the overall country responses on COVID-19 so that it suits various locations. And this has been one of the key success factors in ensuring that the interventions that were introduced at the national level can work and deliver the desired outcomes in different places. So we draw important lessons from that in terms of what works and what didn't work, under what circumstances, and where it worked, for who did it work. So it's very, very important, a reflection in that regard. So in this session, I'll welcome inputs from three strands of inputs. One by the Gauteng province. The next one will be by the United Nations Development Program, and also the third one by the Organization for Economic Cooperation and Development. So from the Gauteng province, we welcome Mr. Ishmael Akalwaya. He is with the Premier's Delivery Support Unit in Gauteng province and has been in the national government for a very long time. He has done quite a lot of work, including a highlight that he contributed to the first national skills development strategy in this country. He is going to be leading a team from Gauteng that comprises Mr. Graham Hotz, who is the Director of Research Strategy at the Gauteng City Region Observatory, GCRO, and Mr. Rashid Sidat, who is the Executive Director of the GCRO as well. Then following that, there will be an input on social and government implications on COVID-19 pandemic in South Africa, which will be done by Dr. Ayo Adusola, who is the resident representative for the United Nations Development Program in South Africa. Welcome, sir. Then lastly, it will be a presentation by Ms. Karen Maguire, who is the head of the OECD's Local Employment and Economic Development Program. In that order, there is times that have been set. The first group would give you about 20 minutes to do your presentation before UNDP comes for 15 minutes, and then OECD will also do for 15 minutes. Then we'll go into a discussion. While we are during presentations, there is a Q&A part where I invite participants to comment or pose your questions. And when we post a poll, I invite you also to be actively involved in the polling. Over to you, Ishmael.
Thanks, Godfrey. Good afternoon, colleagues. I'm going to try and share my screen quickly. Okay, I hope that's working. Okay, so I understand time is of the essence. I'm not going to spend a lot of time. I'm going to just run through very quickly. What we intended to do was present a case study that we've done on how the Gauteng City region responded to COVID-19. I'm skipping quite a few slides, but essentially this is a joint initiative between the Gauteng Provincial Government working with Gtac at National Treasury and the National Research Foundation. So I think we basically collaborated around a project to try and write up Gauteng's experience and how it responded to the COVID crisis. Just to mention that this was done at no cost to the fiscus, so we're very grateful for the contribution of Gtac and the NRF colleagues. So the aim of the study is actually just quite simply to capture the interventions adopted by the Gauteng City region and to document the lessons learned in terms of success, challenges, and failures. So that's what the focus has been on. We've used the methodology of writing up the case study using data collection and data analysis. So I'm going to quickly look at, it's quite a comprehensive case study, over 180 pages. There's 10 chapters. And as you can see, it covers a range of issues from leadership and governance. And that work was done by Dr. Rob Moore and Mr. Graham Gotts from the Gauteng City region. There's a chapter on health that was done by Professor Letitia Rispel from Wits University. A chapter on resource allocation prioritization done by Dr. Lungiswa Nkomki from Stellenbosch. A chapter on the economic response done by Professor Ivan Chirok from University of Free State. A chapter on food systems response done by Professor Hetty Skoenveld from University of Pretoria. The education response done by Professor Salome Human-Vogel. We even looked at community mobilization and compliance done by Professor Rajan Mistry, University of Cape Town, and Professor Laketi Makalela from Wits. So, it's a big presentation, and we had to decide in the limited time what we are able to share in this winter school. So I'm going to hand over to Graham Gotts from the Gauteng City region to basically talk through chapter 2. So the entire report is available, and through the organizers, we can make the entire 10 chapters, 180 pages available. But I think for the purposes of today's session, Graham is going to basically just talk through the leadership and governance response to the pandemic. So I'm going to stop there and hand over to Graham. And I hope that works. Graham, can you take over?
Yeah, thanks, Ishmael. I'm just going to call up my presentation. Okay, I hope that's all visible.
Good, you can go.
Great, thanks very, very much, and thanks to the organizers. Just to say that this is a piece of work that I did jointly with the former executive director of the GCO, Rob Moore, who retired in May this year. But I'm also joined today by Rashid Sidat, who is the new Executive Director of G0. And although I'll be doing the presentation, Rashid, of course, will come in with various insights in the discussion. Key here is the fact that Rashid was a very senior member of the Gauteng provincial government until he joined G0, and has immense insights into the internal machinery of what we're talking about today. So I'm going to go through the slides very, very quickly. Of course, they will be available to you after this session. So just to follow up on what Ishmael has done by way of introduction, this was a case study, a part of a much larger piece of work. This particular survey, this particular chapter was done on the basis of a number of inputs, formal interviews with about 15 respondents, our involvement over the course of about a year with pandemic responsiveness, in particular as part of the Premier's Office-led data and analytics work streams, Rob Moore's participation in the Premier's Advisory Committee, and as part of the above, a host of internal and informal discussions with various officials. We also hosted 2 governance dialogues as the G0 in partnership with the Gauteng provincial government looking at these issues. We ran a panel discussion at the South African Cities Studies Conference on the 31st of August 2020. And then, very importantly, close engagement with Professor Phil Harrison, who's one of the authors of the Governance and Leadership chapter on the National Country Report. So this is the Gauteng-focused case study, but of course there's similar work being done at a national scale. So just to say that, of course, we're looking at a vast apparatus of government. We can only really peer in through narrow windows at particular views. And to note that although we do ask critical questions, this is not intended in any way as an appraisal of interventions. The intention is to illustrate the complexity of government attempts to adapt to a crisis. And so we thank the many senior officials who gave of their time in putting this together. So the case study took its impetus from remarks by Professor Phil Harrison in one of those dialogues that I was speaking about. And I'm just going to read a little bit of this to you. During a crisis like this, governance is tested to an extreme, and it throws into sharper relief than before the character, capabilities, and limitations of governance, and exposes pre-existing flaws, capacity limitations, rigidities, and fault lines. But it also, on the more positive side, reveals adaptive capacities, the relational strengths, the commitment and quality of individuals, the leadership potentials. And if we reflect on it, Phil Harrison went on to say, the crisis also reveals how far we've come in terms of a city-region agenda. And the question here is, can we identify emerging practices that can be consolidated into new kinds of practices that take the city-region governance agenda forward? So we asked a couple of questions. We asked, following this, to what extent did the COVID crisis expose existing weaknesses in government capability relative to what was revealed as the establishment of new systems, structures, and ways of working that could provide a better basis for governance into the future? And the answer is a dynamic one, with narratives of both success and of failure. We asked to what extent, moving from there, to what extent was leadership able to demonstrate dynamism, to move beyond established institutional practice and cultures in a way that was agile, that demonstrated speed and responsiveness to a grave new societal threat. And then beyond that, more specifically, to what extent was government able to be adaptive? And I'm going to draw a distinction in this between agility and the much bigger program of change that we've called adaptiveness in the face of inherited accountability systems, bureaucratic arrangements, organizational values, and day-to-day routines that, if you really think about it, were not conducive to the setting of cross-government agendas that did not, in and of themselves, enable associative agendas and dispositions in pursuit of a common purpose. It should be said, I'm just going to touch on this. It should be said that there's a lot of literature emerging on this stuff internationally. Whole books have been written within the last year on the question of government capability in comparative perspective, looking at different parts of the world to manage the COVID crisis. And it's really interesting looking at that literature and thinking, how does the South African experience learn from what's being said there, but also speak into that scholarship in really interesting new ways. And we think that it does say something into that scholarship that's useful to understand. So the international literature asks similar questions as we are. Will the crisis prompt significant change in the systems and structures of government? The common theme is, as we've said, that the pandemic has revealed both strengths and weaknesses in respective administrations. Sorry, just hang on a second. Sorry, little boy is running in. So just to say that the key distinction is made in the literature between agility and adaptiveness as well, that researchers have observed residual stickiness of routine systems or poorly regulated systems inhibiting a shift to adaptive systemic capacity. But there's also notable examples internationally where administrations have taken political advantage of the crisis or where ideologies have hampered responsive strategies. I'm not going to talk to these quotes, but it's really useful to look at how some people have analyzed what's been done in other parts of the world. I'm just going to note how Maor, talking about Israel, shows how apparently bad governance of COVID in fact reveals a careful political calculus underlying government decisions that keep bad governance going in order to keep government, the leadership at that point in time, free of rivals, criticism, a noisy government environment that enables almost unimpeded implementation of policy decisions and so on. So let's just talk quickly about the architectures for pandemic government. As with national government, the Gauteng Department of Health established some capability really quickly. They called it the nerve center, but it was very quickly realized that we needed an all-of-government response. And so Gauteng followed the national approach of setting up what can be called a cascade of command councils and command centers in all three spheres of government, which was predicated on enhanced connectivity vertically from the centralized National Coronavirus Command Council. Now, there's a lot of talk that this basically followed the precepts of the Disaster Management Act. And that's broadly true, but there's also a sense in which there was an immediate adaptation of that. So this is to quote a senior government official who says, our so-called Provincial Disaster Management Center was actually completely inadequate when we set it into motion in a whole number of ways. And within a week or so, we realized that we had to move beyond what we thought was this perfect custom-built, purpose-built arrangement and develop a series of new arrangements to address the crisis. So what emerged out of this moment was a set of arrangements. That's not me, I promise. A set of government arrangements, which was an amalgam of disaster management capacities and arrangements, and what came to be called the program management model, which was initially designed on request by the provincial government by Deloitte and Touche, but who then basically stepped back after they did some pro bono work to design this program management model. Arrangements were orchestrated politically by the Premier through the Command Council, meeting twice a week, and administratively by the Director General and the MEC, who jointly chaired the Coronavirus Command Center or War Room, which met daily at the start of the crisis at 3 p.m. So literally daily, every single day for a couple of hours, this command center met. The program management model that held us together was understood as an interruption of vertically integrated but separated parallel departments, and its replacement with interdepartmental, horizontally integrated functional areas or work streams operating in orchestrated alignment. And you can see here there were 6 work streams that were established: comprehensive health response, a social security response, enforcement and compliance, economic response, local government, and government continuity. And each work stream had its own champions, its own secretarial function that brought departments together into a collaborative process of working. So the Program Management Office needs to be understood in quite a dynamic way. It was an office, an actual secretariat function with key staff in the Premier's office, deployed to interface work streams. It was also a way of working transversally across previous silos. The war room, that command center, needs to be thought about as both a structure, a process of strongly managed daily meetings, demanding plans and progress reports, and to some extent also a physical center that was present, based in a building in Ormonde in Johannesburg. I'm not going to talk in detail to the next 2 slides, but just to say that as these new structures got going, there was a lot of figuring out that had to be done. And so the process evolved. Some things that were set out in the designs did not actually come to be, and then other features came to the fore. There was a particular point that needs to be made around the role of the prov joints and the military in particular. That's important here. They were present throughout the war room, and at a particular point in time, they stepped forward into certain gaps in capabilities. Later on, ward-level approaches to hotspot management were introduced. A really interesting innovation in the role of ministers deployed to specific districts and metros. For example, Minister Pravin Gordhan was assigned to Tshwane, and we kept hearing from the Tshwane colleagues about the pressure that they were under from Minister Gordhan in terms of making sure that the data was right and so on and so forth, as well as other innovations. Now, let's talk quickly about, and this is more analytical, about some of the things that were done well, worked well, and some of the things that weren't done well in the remaining time that I've got available. It's fair to say that the Gauteng Premier's Office, and notably the DG, orchestrated a set of arrangements and structures and processes that speak to significant leadership agility. And I do want to note in particular the role of the Director General in driving coordination. A lot of our respondents spoke, and you can see this quote on the right, about the DG's immense leadership in this crisis. She provided a vision for what was needed in this coordinated approach, and she didn't let people off the hook if people didn't seem to be cooperating. She pushed again and again in these processes to make sure that people were on board, presenting their plans, reporting on progress, and so on. Apologies, colleagues. I'm hearing a little bit of an echo, but I can't do anything about that. I think it's fair to say that there was some innovation that emerged later on in the process around a Premier's advisory committee, and this was really the Premier trying to say
we seem to have lost the sound, Graham. I would ask the colleagues from Gauteng if you are able to proceed and conclude. Ishmael?
Rashid, are you around to pick up? I think we've lost Graham completely.
Would you like to conclude? Then he will interact with the audience during the discussion time.
Okay. So, yeah. So, look, I think we can raise a lot in the discussion, but I think Graham highlights that there were, from an organizational perspective, the province managed to work across silos, work across spheres, which was very positive. Graham is back, so maybe he can conclude. Graham, sorry, we lost you for a minute.
Hi, can you hear me?
Yes, we can hear you.
Okay, so yeah, just to say that I'm just going to end in a minute or two, just to say that there was some sense in which adaptive measures destabilized patterns of authority, and it took time to reestablish these for adaptive purposes. So it's fair to say that although cross-sphere coordination worked well at a leadership level, a lot of interaction between governments spheres was left wanting. There was some limitations in the fact that there was a deep reluctance to share data, critical data needed to track the progress of the pandemic and what was being done on the ground. And of course, there were some regulatory lapses associated with the swiftness of response, especially around PPE corruption. We can't shirk from mentioning that. And then my last two slides, really just to sort of highlight some of the key insights and lessons. It's really important, reflecting on this crisis, to note that an adaptive system at a time of crisis that stretches across three spheres of state, across multiple functions of government, needs to depend on functional relations between officials with a shared common purpose and a high degree of trust. There was an underestimation in many instances of the higher skills levels required to get this going. There was an underestimation of the gravity exerted by the silos of routine governments that needed to be transcended in this moment. There was an underestimation of the resistance from some individuals committed to and the interest implicated in previous structures. And there was also an underestimation, we feel, about the extent to which sedimented, what we could call perhaps unkindly, but nonetheless, I think accurately, sedimented legacies of failure and a fear of exposure that set up a repertoire of defensiveness, curtains of obscurity. But nonetheless, also the importance of strong leadership in overcoming all of this. And then lastly, my last slide, we must assemble the adaptive capability required in moments of crisis alongside our need to keep routine systems of government ticking over. Some of the adaptive capacity that we need needs to be built in partnership with other players, can't all be from within government. And so government needs to be amenable to partnerships with academia, where scientific skills from things like modeling really exist, as well as civil society organizations that can do things like distribute food parcels, perhaps in a more agile way than government can in some instances. Much greater attention needs to be paid to effective cross-government collaboration. The infrastructure, especially for data management, must follow the purpose or the project, and we must strengthen research and innovation, starting to build adaptive functions and structures now with a high level of tolerance for failure, because they're not going to always work. And then lastly, to recognize that skilled, flexible public service professionals who can work in associative and boundary spanning ways within and allied to government are absolutely crucial in these contexts. Thank you very much.
I think you're on mute still.
Oh, I was on mute. Sorry. I was saying thank you very much to Gauteng team. And then let's cross over to Dr. Abisola. Thank you. Apologies for that.
Yeah, can you see my screen?
Please project. And then you are muted, Dr. Abisola.
Yes, hello. Can you hear me?
It's possible that you may have more than one device connected. If you can switch off one of the devices, please. Please unmute, and let's test and see how it goes.
Yes, can you hear me?
Oh, can we, Doctor, if you can allow us, should we take Karen in the meantime? Yeah, okay. Let's see if Karen can present in the meantime. Over to you, Karen.
Okay, thank you so much. Oops, Mary, you want to say something?
I think Mary would be assisting Dr. Abisola.
Okay, excellent. Okay, well, great. Great to join you in the winter school. I'm here on my summer holidays in France from a country house with the little boys downstairs. So hopefully we'll see if we can get through without them popping in on my side. But I'm glad to join you here from the OECD. I have a little bit of a presentation, so I'm just going to share my screen real quick. There we go. All right, so hopefully there we go. I think you'll be able to see it. Great. So I'm joining you from the OECD Center for Entrepreneurship, SMEs, Regions, and Cities. And so we're really focused on what are the sort of place implications of different public policies and different phenomena? And as Godfrey said in the opening, a pretty important issue for us to be thinking about in the COVID response. So I'm in charge of a program that's called Local Economic Development, which really is trying to think about these local considerations. And I'm glad that South Africa and Gtac are also at the table at some of these discussions we have here at the OECD on some of these issues. So just to put it a little bit into perspective, a crisis is going to hit communities in different ways. And even if you think of the last crisis, almost half of that regions in the OECD member countries, for example, hadn't even recovered a decade later relative to the unemployment levels pre that crisis. This time around, we're seeing, different kinds of patterns, but what I wanted to really highlight a little bit is how the pandemic really has some different implications for what we think about in terms of local action and especially for the recovery. And, one is the sort of more simultaneous country and region feedback. Now, it has been different by months in many cases, but a lot different than other types of crises. I also wanted to just highlight a bit the very unusual place dynamics associated with the pandemic and its economic and social implications. In particular, cities have sort of two countervailing factors, and the one being that the proximity and the density means that infections can spread potentially quicker. However, they also have the capacity in some countries where a lot of employment is able to be done remotely to use that as a buffer. Whereas, of course, we saw in many rural areas, the types of occupations exercised meant that social distancing was not necessarily an issue, but some big challenges with respect to health system capacity to respond when the outbreak does hit in more rural areas. Another major difference is just going to be the sector dynamics of the rebound, which are going to be very different from prior types of economic crises because, in the last one, we saw tourism helped replace some of the hits in many regions, for example, of the OECD, which in this case is not going to be the same. So I think, we'll be talking a little bit more about maybe some of these sector dynamics as well. Of course, the people affected, and I think you had a session just before as well about some of those have been hit the most. The cheese session that was referred to, youth and low skilled, although if I understand the dynamics with youth might be a little bit different in South Africa in terms of where they are with respect to employment, because some of the growth, I guess, in South Africa was in some jobs that were more youth employment intensive. But again, some particular challenges there with the changes. If it looks like the screen has disappeared, so I will hopefully keep going. And if you can't see the screen, I'll just speak to it. Can you still hear me? Just to put a thumbs up if you can still hear me. Yep. Okay. Thanks. So not sure why it's not sharing. Thanks again. We'll try back. In any event, that hits us our last point on digitalization and automation. And of course, the extensive use of digitalization, as we can see from our meeting today. But again, in any crisis, there is a consideration by firms of trying to automate more. And this is going to be even, I would say, supercharged going forward because of the social distancing elements. So a lot of different implications for local development based on the unusual nature of this pandemic, and its implications. So I think one point I just wanted to raise that has come across in the local response is that there's a realization that public health and local economic development are linked in ways that people maybe were not thinking about before. And it's also, we've seen across the OECD and lots of different countries and regions, issues with which communities are most affected, and sort of revealing these different forms of inequalities with respect to firms, with respect to types of workers and what sectors, and with respect to access to different public health facilities. Another point I wanted to highlight was just in terms of the local action for the health and public service response, and then get into a little bit more some of the considerations for the sort of resisting recovery and also rebuilding better, which has become a particular consideration that has been raised in a lot of the political discourse, both at national and subnational level across countries. And of course, many of these are sort of obvious in terms of curfews, confinement measures, mask mandates, and the different role in the subnational level on public health services and how they manage. But also a lot of the complementary social services, the housing, and the organization of schools, which in many cases are actually managed at subnational level across countries. And so there's a lot of innovation in trying to think about what this means. And in particular, in the complementary social services, I wanted to highlight, and we'll talk a minute about it more, the role of civil society in the social economy. And I think there was a question for one of the earlier speakers in the chat about these issues of the sort of consultation and discussions with the public sector. And this is one where, civil society, and this is one where I think, the social economy will become even more prominent. And then, of course, education and transport systems are other areas where we've seen a lot of different action at the subnational level. So in terms of the sort of actions to cushion the shock, I mean, we've seen a lot of complementary actions to support national policies. As Godfrey mentioned, they don't necessarily work unless there is this subnational effort. And a lot of countries, we've seen the subnational governments that have been helping implement the national schemes or adapting them. And in other cases, we've actually seen them develop complementary programs for firms, for workers, in order to top off or maybe target certain types of sectors that are particularly important in their regions. Another big issue has been how to help firms and workers in supporting the very wide range of policies that are implemented at national work on that front. And then a third point was really about just the leveraging the social economy as a partner to the state in helping to deliver services. but as we'll see in a second, also as a partner for really thinking about how to rebuild and transform a bit, because the social economy is often seen as, you know, the group that helps clean up or fill in the gaps or miss the things that are not hit by the public sector. But there's a huge potential to do even more, and the crisis has really highlighted that in a lot of countries. Looks like the screen share keeps going off, so we'll try here again. And then another, just to go ahead to the next slide, another is on the recovery angle. And this is where, you know, I think some of the earlier discussions of the winter school, which unfortunately I wasn't able to participate in all of them, but are, you know, how to prevent the sort of scarring effects on different populations, but also how to address the gaps that were already existing in, for example, business development or in employment and training services. And this has really been coming up a lot in different OECD regions and cities. And what the crisis has highlighted for them are some of the gaps, and in particular with respect to, for example, digitalization for those firms where the digitalization has been supercharged and they were maybe not quite as prepared, but also a lot of work with sectors that have really been hit, like tourism and culture. And there we saw, we're seeing a lot of different efforts to, for example, in the culture sector, to think about it as a tool to help rebuild. But also the fact that in some sectors, the types of employment contracts, et cetera, are maybe not, were not well served by some of the public policies. And so a lot of cities and other places have really jumped in to help support those sectors, or even with tourism, trying to promote local tourism with, for example, vouchers or culture vouchers, or ways to sort of reinitiate locally access and the longevity of those firms and activities that are in those sectors. And then finally, in terms of this rebuilding better, and this I think we can talk maybe in the discussion more about thinking about what are the lessons in this response for how we do things differently. And what was great about the Gauteng was, you know, thinking about how does this change more fundamentally and structurally what we're doing. And so one is this window of opportunity to rethink local development. And so this has come up in, for example, urban planning. A lot of places have been temporarily changing some of their urban planning approaches and use of public space. And these things could become perhaps more permanent. A lot of cities in Europe, for example, some of the bike lanes that were temporary are now becoming more permanent fixtures. There's also opportunities to rethink some of the economic development approaches. And just to give an example, a sort of world famous example of Venice, which has been very dependent on mass tourism. And they are really trying to think about what are new opportunities, and, for example, how to link manufacturing nearby with the culture of the city in a different way. So this is really an interesting window of opportunity for different local authorities to rethink that. Another is just looking beyond the sort of immediate job response and thinking about longer term, what are some of those jobs of the future that we can start to plan for now, especially with environmental imperatives and, of course, increased demand in health type of jobs. I mean, right now we see in France, for example, a new job has been created to check your pass. You're not allowed to go to certain places if you can't prove your vaccination. So there are some of these, you know, short-term types of jobs, but we are thinking about, you know, what are, you know, some subnational governments are thinking about how they can restructure a bit their efforts so that these are more jobs of the future. And this is another area where the social economy, for example, and civil society, where traditionally there's been a focus, as I mentioned, on this sort of fixing gaps, but also thinking about what its role it can be in helping to promote more social innovation and helping to identify and transform a bit towards these more socially inclusive, more green types of activities, which can also generate employment in those sectors. And again, I just want to emphasize the most important digital transition issue. So just to clarify, that the OECD has lots of resources that all of the folks here can access online. The presentation given you some recent reports, but we have a COVID hub that has over 200 notes and on everything from education and science and technology to employment and local economic development. So feel free to access those. And also the center has lots of data that you might be interested in looking at for peer comparisons and in tracking the recovery. But I'm excited to also bring back from this discussion some of the examples that I'm hearing about from Gauteng or from the sort of data, I guess it was NIDSCRAM, I think was talked about in other sessions, so that we can really promote this international exchange to learn from all of this experience. So thanks again and look forward to the discussion.
Thank you. Thank you very much, Karen. Can we go straight to Dr. Adusola? And then after that, we'll take the discussions. Thank you. Over to you.
Hello, can you hear me?
Very clearly, please go ahead.
All right, let me just try to share the screen, I hope. But if it doesn't, I just want to use the opportunity to call on Mary to upload in case it doesn't come up. It is up, we can see it. Is it up? All right. Yeah. Thank you very much. Yeah,
just
good.
Put it on the slideshow.
Yes, okay, thank you. Are you okay now?
Great.
All right. Thank you very much, Program Director, and thanks colleagues that have presented from Gauteng and from Karen from OECD. It's really a pleasure for us to really join you in adding to what previous colleagues have already added. And is just to build on the series of studies we've done on behalf of the 17 UN agencies operating in South Africa. The first one is the Socioeconomic Impact Assessment, which was launched middle of last year. And the second one is the Rapid Emergency Needs Assessment, which was also launched towards the end of the year. The third one is the one that is looking at the governance and social impact of COVID-19 in South Africa. And particularly, it focuses on 4 key objectives. One, to examine the state capacity to manage the spread and containment of COVID-19 in the country. 2, to assess the social impact of the extraordinary state measures that were put in place. And 3, to determine the state's capacity to institute early response and recovery. And finally, to identify lessons regarding the role of partnership between the state and various types of social partners. Well, the beauty of it is that to be able to really achieve these objectives, the key actors comprising both many academic institutions, civil society organizations, including the Red Cross Society of South Africa, and also the 17 UN agencies that operate in South Africa under the leadership of UNDP. We were able to use a combined approaches, both primary and secondary data sources. And the first one is for us to really administer the household survey towards the end of May. That's covering the 4th and the 5th levels in 4 provinces: Gauteng, KZN, Eastern Cape, and Western Cape. And at the end of the entire process, and because of the lockdown process, it was a telephonic interview with 1,717 respondents that correctly filled the instrument. And this primary survey was complemented by secondary sources and desk review, and also the formation of reference group at the technical level and the sounding board at the political level, where we use them to really review the entire process, comprising departments, national department, provincial department, including Gauteng, and many other provinces, and also academic institutions that really provide some kind of reflections and feedback to reflect the reality on the ground. What we were able to achieve is that the combined approach provide what we called the research study with clearer understanding of the impact of COVID-19 situation on the ground. And I just want to also amplify the fact that the main thing is for us to really look at what the reality on the ground is. Not supposed to be a very detailed and in-depth discussion. The main deliverable which we are targeting is for us to be able to bring out some kind of key research findings across health, governance, and socioeconomic domain, and also provide basis for us to really strengthen the governance structure on the ground. And I just want to note that looking at the typology of the various stakeholders, we realize that one, if you look at the typology of respondent by grant recipients, you can see the categories where about 50% of them were direct recipients of child care, and then moving to the recipient of old age pension, which is about 18%. And you have those that are foster care grants, 2.1, and 5.1 for people with disability, that receive disability grant, where we have 2.1 again for care dependency grant. And at the end, we realize that 23.2 of the main respondents did not have access to any grant whatsoever. And if you look at the typology of responded by COVID relief facilities, it varies from a number of indicators we used. Invariably, only 10.4% of the respondents, that's out of 1,717 responded, indicated that they have had received special COVID relief grants. And also a smaller percentage, about 5.4, indicated they had received a temporary employer or employee receive scheme grant. And also you have about 2.3% of the respondents indicated that they received support for small businesses. You can see that access by small businesses is extremely very low. Then if you look at it, 35% of the respondents indicated they had applied for this special COVID relief grant, while 65% indicated that they were planning to apply or hadn't applied at all at that particular moment. Now, if you look at the typology of responded by access to food parcels, this is where you see that the proportion of people that had access, especially between levels 4 and 5, is only 23% of them that received a food parcel, which shows that it's proportionally very small. And also, if you look at most of the food parcels were provided by NGOs, individuals, including the Red Cross, the Gift of the Givers, Ray of Hope, African Ticum, local churches, and among others, including some development partner. Only 15% of them were provided by various departments of government at national, provincial, and municipal level. So it shows the kind of disaggregation we have on that. Now, if you look at the gender dimension of the lockdown, and well, the beauty of it is that there are many avenues through which the lockdown affects women, but we're able to group them under 3. One, if you look at the exposure to risk as a result of many women being involved in the essential services like teachers, healthcare workers, community volunteers, and the other social service sector, where about 63% confirm this as the reality on the ground. And also, if you look at the impact as a result of increase in gender-based violence, about 66.5% of the respondents confirmed this as the reality on the ground. And the last component in terms of increased workload as a result of lockdown, then this shows that about 75% of respondents declared this because women had to do a lot of childcare and some other caregiver, even while at home. So this is the areas where the impact become quite dominant in terms of the impact of COVID-19. Now, I wouldn't want to restate what Graham mentioned earlier on in terms of the structure of governance when it comes to the issue of pandemic response. But what is critical that we have to note is that given the special context of South Africa and being the first time to invoke Disaster Management Act, it was really a testing case, and that offers so many lessons for the country because the Disaster Management Act is to establish the governance structure that reflect war, depression, and natural disaster situation. And this is it. And I wouldn't want to mention all the various layers of committees that were put in place, as well as centers and advisory committees. But just to re-echo what Graham has mentioned earlier on, that these are the structure that were in place, which to a large extent stand South Africa clear relative to its comparators within the continent, even across the world. It really shows that the governance structure have a lot of strength in terms of response to mechanism. This is part of the findings we got. The first element of the strength relates to government communication and information services, which respondents consider to be very inclusive, speedy, and well-coordinated strategy. And as a result of this, the World Health Organization towards the end of the last year gave the country that award, which shows the communication strategy and the leadership content of the information spread is quite good. And also, if you look at the establishment of Solidarity Fund with the allocation of 500 billion rand, about $26 billion, it's the highest in Africa. It really shows that there's element of commitment in terms of what we have on the ground. Also, one thing that is very unique about the governance mechanism in terms of response in South Africa is the role of society through what we call the social impacting approach, where the private sector, the civil society organization, the government come together to really support the process. And it's a testing case in terms of good examples, not only in Africa, but across the world. And also, if you look at the kind of experience the country has had on HIV and AIDS and TB, which provided opportunity for leadership to be extremely strong and to really respond effectively in this regard. But there are a number of challenges associated with the response mechanism. But the key message from the challenges is that the existing disaster management governance arrangements are not strong enough to meet with the VUCA context, relating to issue of volatility, the issue on uncertainty, the issue of complexity, and the issue of ambiguity, which is the context of COVID-19, and is therefore providing a limited opportunity for the government and all the other actors to really respond the way it should be. So this is a major thing and the major message that is coming from the study. And the key challenges which we want to really mention relate to a number of things. And I just want to really emphasize the need to really enforce restrictive rule while enforcing basic human rights is a major challenge, because they are unable to really balance the two effectively. And at a point in time, you see a lot of complaint about really the use of force, which impedes on human rights of the people. Inconsistent, ambiguous, and contradictory messages from digital and broadcast media is created a lot of confusion for people, and that's one of the things which I think a major lesson for us as a country. Also, activities of oversight institutions were impaired. Human Rights Commission, the Gender Commission, Public Protector, all this, they were unable to deliver their responsibilities within the lockdown context. Also, restrictive movement affected supply chains with serious impact of cross-border trade, informal sector activities, migrant refugees with no access to unemployment insurance fund. It really provided opportunity for us to have a rethink on how best to address those challenges. Also, the PPE-related corruption and abuse of public procurement process is one of the governance issues that rear its ugly head during this era. And it really shows a good test of our procurement process and how to build it for resilience. Limited response capacity of the local government level is an issue. If the 278 municipalities were to respond, the way the 9 provinces and the national government respond, it will have been a different story as of by today. So we need to really see how that is effectively addressed. The issue of safety and security is also impaired, because respondents says about 60% of our responses confirm this as a critical issue, Gender-based violence increase, particularly relating to child neglect, emotional abuse, physical violence. These are issues that came prominently from over 70% of our respondents. And also the issue of the need for us to really look at the issue of mental health. About 68% mentioned this as something that is really very important. Now, another issue, which is a major challenge, is the digital divide that really is showing its ugly head. One, if you look at schools in urban centers and schools in rural areas, while schools in urban centers are having access to what we call virtual learning, it's not possible in rural communities. Then you can see that it's creating a kind of intergenerational gap, not only in terms of digital divide, but also in terms of inequality, the same thing with issue of health and the same thing with issue of telecommuting. These are issues which we consider to be very important. We need to look at for, and then provide policies to be able to address this issue of digital divide between urban communities and rural communities. The high impact on the most vulnerable group is another issue, which we think there's need for us to really address this. Hello? Yes. Okay. Now, in terms of policy review, we just providing some kind of snippet in terms of what we need to look out for. One, the first thing is for us to look at the pandemic itself. How do we address issues like this when it comes? First, we need to assess effectiveness of disaster management response and governance arrangement. It's good for us to really do a thorough and depth analysis of this so that it provides opportunity for us to really manage things like this when it comes. Because COVID-19 has come to stay, and what we need to do is to devise effective coping strategy. Two, we need to find innovative solutions to address health, economic, social impact on citizens and businesses. This is something that is very important that came out prominently from the study. We need to devise mechanisms to reach the most vulnerable members of the society, because in many countries in Africa, not only in Africa, across the world, those that benefited from it are not those that are hardest hit by the pandemic. Find affordable and effective ways of supporting workers and SMEs under conditions like this. And fifth, we need to devise most effective way to rebuild social capital and social cohesion, because COVID-19 has really weakened the social fabric of the society, and there's need for us to build on this. In terms of social interventions, also we propose some other ideas. One, there's need for us to have a review of the income distribution mechanism, meaning we need a new one that will be able to really reach the most vulnerable, especially in terms of national basic income. What we have to look at its financing and its affordability. Two, there's need to really introduce well-targeted support to informal sector operators. Three, we need to address patriarchal power relations, as well as enforce human rights-based framework. These are things that need to go together. Fourth, we need to reimagine resilience, social compact, and social cohesion, as we mentioned under the pandemic. And finally, under social intervention, we need to review and update human resource and workplace health safety policies, plus business continuity facilities. When the lockdown was introduced, even many government institutions do not have business continuity. How do they operate when under that emergency situation, even outside their office? Very few, both the private sector and the public sector. This is an issue which is pointing to a kind of lesson we need to watch out for. Also, if you look at the health system readiness, 5 things came out very prominently. First, we need to review the health system readiness, looking at the strengths, weaknesses, opportunities that are threats across tiers of government, national government, provincial government, as well as municipalities, because they are what they call heterogeneous capacity across the tiers of government in dealing with this pandemic. Also, two, we need to integrate national pandemic surveillance system into the global architecture, so that there is a kind of harmonious harmony and synergy between what we do at the national level and what the global architecture, health architecture, is all about. Three, we need to streamline protocols for protecting frontline health caregivers. It's relatively far better in South Africa than many other African countries, but there is room for us to improve. Fourth, we need to improve health infrastructure, including skilled workers, research and development, and health tools that will help us to deliver in more effective and efficient manner to issues of pandemic. Gender disaggregation of public and private health responses become critical so that we'll be able to look at the impact in a more meaningful way than just aggregating all of them. Now, if you look at the policy overview with respect to governance, we have about 8 anchors here. The first one is the need to review South Africa disaster management response capability, including early warning system and recovery capacity. 2, we need to do the post-COVID scenario planning system in the country to incorporate disaster management framework, because the current one does not have this, and that's why we're caught napping when it happened. The third one is for us to invest in disaster management system at local level, because the capacity at local level is completely different from what you have at provincial and national level, and there's need for us to invest on that. The fourth one is to build on lessons from the whole of society approach of governance that was adopted when COVID-19 struck, and then emphasize the need for us to really bring out the role of non-state actor very explicitly. Also, on the fifth one is to review the current review of current planning system to make it agile to working under volatile, uncertain, complex, and ambiguous context. The way it is still normal. I mean, the planning system is the one that is adhered to normal environment. I think we need to really reflect this. The sixth one is we need to focus on technologically enhanced public service. This is really needed. With it, it will be difficult for us to compete globally if the public service is not technology savvy. And that's one thing that is very important for us to look at. The seventh one is the clarity on the limitations of authorities and consequences of abuse. Yes, I'm concluding now.
We will need to conclude, yes. Thank you.
Yeah, so that's one thing which is really very important for us. And I just want to really show that the main conclusion here is that what can we do based on what we have found from people in creating a pathway for a post-COVID-19 era. First is the need to resolve by addressing the immediate challenges that COVID-19 presents to the country, the society, the workforce, and institutions. 2 is to address immediate social and economic management challenges and broader resiliency issues, including virus-related lockdown. 3, we need to really create detailed plans to return society and the economy back to scale quickly as the virus evolves and knock-on effects become clear. The fourth one is that we need to reimagine a post-COVID new normal, what a discontinuous shift looks like and the implications for how the country should reinvent. And finally, reform is critical. We need to be clear about how social practices, regulatory and policy development, as well as socioeconomic factors may shift and evolve as we progress. So we need to really make sure that our institutions become critical in managing issues like this. Colleagues, these are the main outcome of the findings, and it's a working document. We'll continue to really see how this can inform governance capability to manage preparedness and recovery as early as possible. Thank you for your attention.
I was busy clapping my hands there. Thank you very much, Doc. We thank the 3 presentations that have taken place. Before we open up the discussion, we would like to invite Dr. Dombo from Limpopo to share some lessons from there in 5 minutes, please. And then we'll go into discussions. Please restrict it to 5 minutes, Dr. Dombo. Welcome to you.
Thank you very much, Mr. Mashamba, and good afternoon to the speakers and attendees. I think to share in 5 minutes, would you permit me to show you some pictures while I speak briefly?
Thank you. Please do that.
All right. Can you see my screen?
Not yet.
Oh, okay. I think I'll just start having some trouble accessing the items. The Limpopo Department of Health has been focusing most of its campaign on social mobilization in order to ensure that we are able to attract and ensure uptake. So what we've really been focusing on is using a hub and spoke methodology where our hospitals are the primary vaccination sites, supporting primary health care fixed sites followed by outreach programs. So with each age criteria that is introduced into the vaccination program, we have been able to then increase our delivery platform to accommodate for that. And one of the strategies that we've really wanted to adopt and have been implementing is targeting the actual people and taking the vaccine to the people, vis-a-vis when we first started, where we were mainly based in your actual facilities. So what that has then assisted us is to be in a position to actually increase. For example, we know that there are people who have got difficulty in mobility. So we have what we call community health workers who, because they work in the community and they know the people, then pre-vaccination day, they go and recruit people, and then the teams are able to follow those people with mobility problems or inability to access transport at their own homes. The other strategy has to be to work with traditional leaders as well as church leaders, because those are the people who are influencers within our communities. So we've been able to, for example, vaccinate the 2 bishops from the ZCC Church. We've also got access to tribal authority structures to maximize the access to our people. Look at the issue of weekend vaccination, high transit zones such as your malls, and as well as your actual mining houses, areas of work in terms of the farming houses. So those are the areas that we've been accessing, and that assists us with getting more uptake for people who would otherwise be confined to the workspace and not able to visit a vaccination site during the week. We've also worked with recreation and sports groups and be able to mobilize them to do some weekend drives. We've done some drive-throughs just as part of the innovation of getting more to people. Our current expansion plans include ensuring that all our primary healthcare sites become primary vaccination sites, such that they can receive vaccines directly. And we're also looking to ensure that, since we have an existing mobile primary healthcare service, those visiting points should be offering vaccines since we are there anyway. So that is part of us taking the vaccine to the people, and we're working with various sectors as well to ensure, for example, the higher education with the new age group that is about to come in, to open it up at universities. We've got 2 fixed outreach sites as we speak in the 2 universities in the province, and we're wanting to expand to the TVETs in the next few weeks. So those are some of the strategies that we've been utilizing to increase the uptake. And so far, we have been able to reach more than 60% in the 65% in the age group above 60. And we are following suit with the age group 50 to 55, where we are in the 40% mark. And with the new age group of 35, we are still low in the 20s. But looking at the weeks since they've started vaccination, we are also hopeful that they will follow the same trend as the 60 years and above. So that, in brief, is what we've been doing in Limpopo.
Thank you very much. I see that there was a wide applause in terms of the successes that Limpopo has achieved in this space of the vaccinations. So that talks to the big topic that we are dealing with here, of how national interventions have actually been localized or adapted to fit in with the local circumstances or conditions to make them work. With that said, I would like to invite comments and questions from participants. I just need to familiarize myself as to where are the hands. Okay, here we go. By show of hands, who wants to comment? The technical team, please help if I can't see from my side. I can't see any hand.
Yes, there isn't currently any hands, Gabriel. I mean, Godfrey.
Okay. But what we see, I can make some remarks in case that given that there's no hands to comment. I think drawing from the various presentations, we see how the lessons from the 2 provinces that have been shared have actually adapted the national level approach to local circumstances, because there are certain realities that need to be taken on board to make them work, the approaches to work or the responses to work. But then again, we've also drawn from the study that was done across, an analysis from across countries by the OECD, to pick up on some of the key considerations that are applied in various places that they've looked at, and the study by UNDP looking into specific approaches that were used in South Africa, and the number of studies that Dr. Adusola you referred to, which I think gives us a sense of what approaches worked, and a sense of what are the specific challenges that require further analysis, and maybe areas that some of the students might be interested in doing further research in those spaces. I would like to ask, Gauteng, you had a further point that you wanted to add beyond the time that we have allocated you earlier on. I would like you to go back to that point.
Chairperson, maybe I should just come in here. I didn't specifically want to make any additional points. I did want to note that Rashid Sidat has been really struggling with the connectivity, and I'm not sure whether he is able to come into the conversation at this point. If he is able to come in, it might be useful to hear any thoughts or reflections from his side. But I don't want to make any assumptions on that front. Ishmael, I'm not sure if you want to say anything, but maybe just to sort of pick up on something that I was saying and push it a little bit. One of the thoughts that I would want to put up for discussion is this question of the agility that we saw at the beginning of the crisis versus the adaptiveness of government systems that you really want to see beginning to come through over a period of time in response to the crisis and what it's left us with. So, and let me just be provocative for a second and see if there's any responses to this. That my sense is that Gauteng in particular was very agile in its responsiveness. And there's a lot to applaud in terms of the structures, systems, ways of working that got over inherited problems, inherited ways of working that were not conducive to the task of managing a crisis. But that over the last 18 months, we have not seen the aggregation of new capabilities. In fact, we've probably gone into the third wave of the crisis with not much more capability than the way we tackled the first wave. In fact, there's a sense of complete exhaustion. There's a sense of complete, like, okay, we've just had enough of this. I'm sure that this next wave is not going to be all that long. We'll just survive it somehow and hope for the numbers to come down. Rather than a sense that we've aggregated capability to more actively manage things into the future. And it begs the question, if there is a fourth wave, given vaccination numbers, if there is a fourth wave, are we going to be ready for it or not? My sense is that we haven't aggregated the capability that we need to aggregate over the last 18 months, regardless of the fantastic agility that we saw at the start.
Graham, if I can just add, Chair, if you allow me, I think one of the lessons we've learned and picked up is that how, as a province, how as society, working across spheres, we were able to focus and mobilize resources, energy to deal with a particular issue. So for us, you know, we're looking at another small case study at the moment where we looked at the demand and supply of hospital beds to cope with the demand. And it was a very complex exercise because you need to look at the modeling data, you need to see what is the demand. And when you talk of a hospital bed, you talk of a functional bed. You talk of a bed that has the required medical technology, but also the human resources. And the only way we were able to stay ahead of the curve was to break the silos, to make sure that you were able to work across departments. So in Gauteng's case, you have the Department of Infrastructure Development that's responsible for the physical infrastructure within a health facility. But again, the Department of Health has its various components, including HR, medical technology, and working with the CEOs of hospitals. But the only way, as I've mentioned, we could deal with it is to break those silos, have strict routines. And here again, I think Graham has mentioned the role of the DG in managing this almost on a daily basis initially, to check, are we prepared Do we have the information? What is the demand looking like? And it's only through that persistence use of data, working across silos, that we were able to stay ahead of the curve. So in Gauteng, even though we realized the fragility of our Department of Health, the huge amount of challenges it's faced over the last 2 decades, the hospitals did not break. Yes, they creaked. There was pressure, but due to the robust management of the technicians, the technical people, CEOs in hospitals, and the medical personnel, we were able to stay ahead of the curve. So for that, I mean, in Graham's question, that's one lesson that we are hoping to take forward to deal with other problems and challenges. In Graham's report, he talks of wicked problems. And, you know, I think as government, as society, we need to deal with issues like youth unemployment, environmental issues, and a single department, a single sphere, working only within government is not going to address those issues. So hopefully those lessons can be built on, and that we can expand on going further. I'll just stop there.
Thanks. Yeah, I've shown this slide on the screen just to emphasize the points that was I think it was made by Limpopo on the vaccination drive. That when you look at this slide, it just shows that the approach of one dose, 2 dose strategy, how it manifests itself in different places. That Limpopo, for example, if you look at this slide, it shows that Limpopo has made quite a big success in the vaccination using the single dose kind of approach. For various reasons, this is influenced by various reasons. It just emphasizes the point of national strategies, how they work at a local level through adaptation of the approaches. I thought I should just share this slide. This is the slide summarizing the data on vaccination. Thank you very much. I would like to, okay, let me stop sharing. I don't know if Dr. Dombo does have a comment to make in closing, because I think we have now come to the end of the time that we're allocated. We were allocated up to 14:15, but we went and used all the time that we have been allocated, 1.5 hours now, even though we started late. If there are any closing remarks by each of the speakers, starting with Limpopo, and then 2 minutes each, and then we close the session.
Thank you. I think for Limpopo, the most important thing is adaptability, because the situation is changing all the time. There are local factors, there are national factors, there are international factors. So as and when things are changing, we need to be adapting. There's issues of vaccine hesitancy. How do you increase the vaccine uptake amongst the different age groups? And all of that requires an increased level of vigilance on the social mobilization space, an increased level of vigilance in terms of monitoring your numbers, and being very clear in terms of strategic recruitment and enrollment of potential vaccinees. So I would say those are the areas that need to be strengthened. And finally, supply chain management. I'm glad the previous speakers brought in the issue of capacity within government. And those are the things that also need to be taken into account, and changing those structural areas such that there is a faster ability to procure as the process is changing, and to ensure that we can reach the levels that we need to in terms of vaccination before the 4th wave is upon us. Thank you very much.
Okay. Dr. Hadsola, and then Karen, you'll follow after.
Yeah, thank you very much, Geoffrey. I think this is really great. Thanks to colleagues. I just want to underscore the importance of local government capacity. Every development is localized, and unless we are able to develop municipality and local capacity to the level to be able to respond to issues like this, I think there will still be opportunity for us to really build more capacity at the local level. So this is something that I consider to be very important in terms of the response capacity and the recovery capacity. This is really very important. And in this regard, we are currently working with the National Disaster Management Center, UNDP, working with them to really increase the early warning capability and also the coordination function of the National Disaster Management Center. And we strongly believe this will help us to really support the kind of implementation around this. The social protection, social cohesion project we have with the Department of Sport, Art and Culture is also to really help us to address the social fabrics that have been terribly damaged by COVID-19. And finally, the partnership we're having with the National Planning Commission, as well as the Public Service Commission, in terms of building state capability, focusing in the area of inclusive participatory governance process, quality service delivery, and professionalization of the public service. We strongly believe this will help to really move along this line. And I'm using this opportunity to call on international development partners to support the national, provincial, and the municipal level to be able to reach this particular level that will be more or less the pace setter for all African countries and for many countries in the world. Thank you.
Thank you very much. Karen, your concluding remarks.
Great, thank you, Godfrey, and thanks to all my colleagues here on the panel. I guess a couple of points. One is really the sort of fault lines that are exposed by something like the pandemic and what that means for action going forward. So we just heard a lot about sort of local capacity and some issues there. And I think it also revealed some challenges in national policies that were maybe ill-adapted to serving certain places, certain communities, certain types of workers. I think another issue is just resilience going forward. And that's where a lot of the work that local governments and in particular local civil society and the social economy will also be helping with social innovations to address some of these changes. I mean, if I had done a poll that said if we thought 2 years ago we would all be sitting in this virtual room for this session, I'm sure none of us would have perhaps thought of that. And so be able to not only be agile, as Karen was said, but also be able to adapt to some of these really more important structural changes that will affect how many workers are going into central cities every day, what that means for transport systems, what that means for social service systems, different settlement patterns. There's just such an amount of potential change that the pandemic has highlighted, that this local resilience to find those different tailored solutions, which are very, very different in the middle of a certain community in a big city to a more rural area. And then it also, I think these kinds of events expose where there are fault lines in the ways that national and local governments work together. And that's another area that I think we can look for additional lessons going forward. But I defer on the specifics on public health to the colleagues that are, focusing in on the front lines than that, because there are a lot of cultural context considerations and what works in public health that other colleagues are best placed to speak to. But glad to join you here today, and it was really great to learn about the examples in South Africa to bring back to other OECD countries.
Yeah, thank you very much. I think the same sentiment here. It was great interacting with you colleagues on this topic. And then for an exchange, I think also the students that are in attendance would have enjoyed the session, and hopefully you are inspired with the kind of discussion that we've brought to the table. and hopefully you'll find it contributing to what you are doing in your respective projects. So I may, in conclusion, to remind students about the debates that's happening tomorrow at 14 hours. I was asked to give that reminder, and that there will be a prize for the best performing team at the end of the session by the head of the Gtac tomorrow also. I'll leave it there, colleagues. I thank you very much for the time and the patience and the attention in this session. Thank you very much. Bye. We'll end the session here.